Well, it is here. We knew it was coming. We knew it was going to be here. This from the New York Times. In U.S. and Germany, community transmission is now suspected. Fan-fucking-tastic. So it says, first potential case of community transmission is reported in U.S. A person in California who is not exposed to anyone known to have been infected with the coronavirus and who had not traveled to countries where it is circulating has tested positive for the infection, the Centers for Disease Control and Prevention said Wednesday night. The case may be the first instance of community transmission in the United States. The case was detected through the U.S. public health system and picked up by astute clinicians, a CDC statement said. It brings the number of infections in the country to 60, including the 45 cases among Americans repatriated from Wuhan, China, the epicenter of the outbreak, and the Diamond Princess cruise ship, which was overwhelmed by the virus after it docked in Japan. The potential transmission in the new case is a source of concern. That would suggest there are other undetected cases out there, and we have already started some low-grade transmission, said Dr. William Schaffner, an infectious disease specialist at Vanderbilt University. So, what that means is if this person got it, and we have no idea who gave it to him, it's out there. And you have to remember, they've only tested 500 people, so, maybe now it's 600 or 700. But the fact that one of the people that they happen to have tested, obviously this person had symptoms, has it, would tell me that there is a shit ton of people out there that have it. And the idea that we're going to stop the spread at this point, we would have to shut everything down right now. Stay home from work, only the essential services, stay home from school. This is just crazy. We better hope that the death rate is not nearly as bad as some people would have you believe. I still think about 2%. Now, the other story here is the fourth passenger on the Diamond Princess has died. There were 705 passengers confirmed infected from the Diamond Princess, and now the fourth passenger has died. So if my math is correct, that means 0.05% of the infected have so far died. Now, of course, that number is going to go up because there's a bunch of people that are infected right now, and, I don't think that fourth one is going to be the last one to die. So we'll see what happens with that, but it's really hard to get an accurate reading on the numbers right now because of the chaos and the numbers of unreported, just the nature of this virus, really. So maybe our best bet for getting a baseline on the mortality rate, on the case fatality rate, maybe the Diamond Princess is our best option for that. So we got to keep watching that. The fourth passenger has died. 0.05. I suspect that's going to go up. Now, Trump had his little press conference today, and the government's definitely downplaying this. At this point, we know that there's community transmission in the United States. So a part of me understands. There's really nothing we could do to stop the spread right now. I think that the government dropped the ball big time as far as the last month is concerned. But moving forward, I don't know if it's going to do a lot of good to tell people what's about to hit. I don't know if that would do a lot of good. I don't know at this point what would do a lot of good. I really hope that our medical system has the supplies it's going to need. I hope that when the outbreaks do start flaring up throughout the United States, that that this incubation period and good health care can kind of spread out the damage so that our healthcare services aren't overwhelmed. Um, the incubation period sucks because it's making this virus way more transmissible. But one upside to that might be that you might have a bunch of people in the community that have the virus but don't have to be hospitalized for a couple weeks. I don't know. Silver lining to everything. But the bottom line is if a ton of people get sick and our hospitals are overwhelmed, that is definitely going to increase the case fatality. So we'll see what happens. Hopefully, part of the reason why it seems so bad in China and Iran is because their healthcare services aren't quite as good as ours. And I'm not saying hopefully as in I'm glad that they're not doing good. I just, obviously in the United States, I would like for us to fare a little bit better than what we're seeing. So yeah, I think the government's definitely downplaying this a bit, and I can see why. And I hope that even though they're publicly downplaying it, I hope that behind closed doors, they understand the severity of this, and I hope that their actions going forward in the next weeks and months accurately reflect that they're taking it seriously. I can totally understand not wanting to throw people into a panic, but I don't understand the inaction. I don't understand sitting on your hands and waiting till the last second to do something. I really don't. Proactivity would have gone a long way with this crisis. China dropped the ball big time. They didn't tell other countries what was going on. It seems like they were lying about the numbers there for a while. They were definitely downplaying it because they didn't want people to stop coming to China and stop trading with China. But we've known that this is serious for weeks now, for probably a month now, and the U.S. government hasn't really done much about it to prepare the public, to prepare the hospitals. The CDC initially came out with the test kits that they were going to send out, and then we found out that those test kits were flawed, and so now we only have the means to test maybe 100 cases a day. That's not sufficient. That's just not sufficient. There's no way to get a grip on this virus if you can't test people for it. It's insufficient and unacceptable. And, if you think that this is the only area in which the U.S. government is unprepared, then you're woefully mistaken, my friend. There are several areas like this where the U.S. government has gotten away with just doing the bare minimum for far too long, and really every government, the Chinese government, the World Health Organization, that's not a government, but the World Health Organization is totally corrupt. They've totally fucked everyone over with this, with their handling of this, with their mishandling of this. So now it's spreading around, and for everyone that was saying, well, it won't get here, it's here. It's here, and it's being spread around, and there's no way to trace it at this point. So here we go. I'll talk to you guys in a bit. I'm gonna make some non-coronavirus videos. I am legitimately interested in coronavirus, and it's not like these videos I'm doing are getting a ton of views. So, I've been tracking this coronavirus stuff for a couple weeks now, and I finally just decided, you know what? Why don't I just talk about it on YouTube? Why not? And also, I was having trouble finding people talking about it, you know, people that weren't the WHO and the CDC. So I figured, well, maybe there's a vacuum there. I think a lot of that is because Google's fucking burying videos, but leave that for another video. All right, guys. So everyone have a good weekend coming up here. I know it's Thursday, but weekend's coming up here soon, and I will talk to you in another video very soon. All right, bye.